Mental Health America of the Mid-South is an educational nonprofit, and our mission is to improve the lives of persons living with mental health challenges. We do that through three primary avenues, the first of which is advocacy, advocating for both an increase in mental health resources, but also access to those resources. We also educate professionals in the field, not only behavioral health professionals, but also first responders as well. And finally, we also educate the community, different coping skills, warning signs, and just helping navigate the process of how to start and where to go. Mental Health America of the Mid-South is an affiliate of the National Mental Health America. And when we look back to the early days of mental health intervention, individuals that were diagnosed with a mental health condition were actually incarcerated and shackled and put into asylums. And we've come a long way, and it's really cool to think about how we've been a pioneer to help decrease that stigma over the years. In our logo, we actually have a bell. In 1953, the National Mental Health America actually collected the shackles from the asylums and melted those into a bell, which is now the Bell of Hope, and symbolizes the freedom that we have today. What still currently exists, though, are the invisible shackles that the stigma around mental health still has on individuals. So we as an organization are seeking and really working to try and help decrease the barriers to access and increase the conversations being had about mental health. I think there are three main things we want to look at in this for this particular question. The first is access to lethal means. The second is access to care. And then also the stigma associated with mental health. And so when a person who is in crisis is using a substance and has an increased access to lethal means, they're at an increased risk for dying by suicide. And so our organization is seeking to help try and provide those resources on the front end, as well as reducing that stigma so that we can ultimately try and decrease the rate of suicides in Tennessee. Mental health care is health care. So just as someone would seek health care and support if they were to break their arm, let's say, it's just as important to seek that support and care if you're facing a mental health challenge. I keep coming back to the whole stigma of mental health, and a lot of people are afraid to even have those conversations with the people that they care about. But it's actually proven that having the conversations about mental health actually decrease some of the symptoms that you're experiencing. A lot of individuals don't know where to start. And Mental Health America of the Mid-South offers free, confidential mental health screenings that you can take through our website. And these screenings actually provide resources local to your area and can help start a conversation, whether it be with a loved one, your therapist, or your mental health provider. Our organization is really seeking to get information into the hands of individuals, both from the professional side, but also the community side. So whether we're educating students on bullying and self-image, to working with organizations to fine-tune their suicide prevention protocol, our goal is to get them the information they need to be successful in a moment of crisis. I definitely want to encourage everyone to take one of our free mental health screenings. Again, they are anonymous and they provide you with free resources following the conclusion of that screening. And you can take those as many times as you want. I personally check in with myself periodically on some of those screenings. We also have a fundraiser, our Jack C. Massey Leadership Award Dinner on November 8th. It's honoring Mr. Marty Dickens. If you'd like to learn more about sponsoring or attending that event, you can learn more at our website at mhamidsouth.org.